What's up, everyone? How's it going? Dr. Todd from Move Now. I want to talk about a couple things today. One, I want to talk about segment posture movement and how this concept is very relatable, and it's a great thing to be explaining to your patients, and it's your way to get your foot in the door in a lot of places that otherwise would not be responsive to you if you just said, hey, I'm a chiropractor. Not to say that we are embarrassed being a chiropractor or we're trying to hide that, but this allows it to come around full circle and people understand how chiropractic fits into the equation when we start with movement and when we really break it down with segment, posture, and movement. That's one thing I want to cover. The second thing I want to cover is something clinically that in practice, when I learned this, it was a big game changer for me, and that is talking about hip extension or lack thereof and how that affects thoraco-lumbar pain and low back pain in your patients, why you want to explain this to them, and why they will understand the importance of regaining and educating this functional movement pattern so that they can live a life without suffering from certain aches and pains, but really getting the big picture of how this is about function, not about pain necessarily. So with that said, again, my name is Dr. Todd Pickman from Move Now University. We help chiropractors integrate their practice with functional movement and corrective exercise in 90 days. We've done this many times. We have a lot of chiropractors that follow our stuff that have done it successfully. It's helped transform their practice and given them a joy clinically and systems-wise that maybe they didn't have for years and years, and now they're happy to go into the clinic again. They're getting better results with their patients, they're having more fun, they're better engaged, they've built a culture, and it's just, once you learn this stuff, honestly, there's no looking back, all right? You can't unsee something once you see it. So if you don't want to see something really cool that might change your thought process and how you practice, turn this off right away. But if you're open to seeing this and you want to learn more, keep watching. All right, so first off, this picture right here, we have a picture of a segment, okay? So we have a spine, and this is just kind of a very rudimentary picture showing that, okay, if there's a segmental subluxation, there could be a problem with the disc or any of the other 9 spinal ligaments around there, or whatever other mechanism that you like to use to explain. I know that the bone on nerve mechanism that was explained long ago has been replaced with more scientific data showing exactly how a segmental subluxation affects someone's function and overall health. But we talk about segment, all right? And we also talk about how your spine controls everything in your body as far as protecting your spinal cord nervous system, which controls everything in your body. So this is the main circuit breaker. It's the main place you want to look to regain, maintain overall function and health in the body. All right, so that's first off. Then we talk about how when you have a problem segmentally, that can weaken regions of the spine and cause the posture to shift and distort, like this dude over here. And you can see we drop a plumb line and we show that this guy has an abnormal sagittal balance. A very important thing to recognize that sagittal balance is a highly researched topic and concept in the peer-reviewed literature, not just chiropractic stuff. Neurosurgical journals, orthopedic journals, physical therapy journals. This is a thing where they've shown that abnormal sagittal balance leads to a decreased life expectancy, worse health outcomes. So this is a highly accepted concept in, like I said, the peer-reviewed literature. Us as chiropractors, we should know this stuff, we should own this stuff, understanding sagittal balance, posture, and how to fix posture too, which is a really important thing. So segment posture. And then here's the third part of the equation. Let's say you have a patient that comes in, you fix their segmental integrity, you get all the joints moving nice and there's no inherent, focused areas of inflammation or fixation in the spine, things are moving nice, right? So segmentally, check. Posture-wise, let's say we get them into a more upright sagittal balance, and on the front view, there's not huge abnormal frontal plane issues, okay? So let's say that we fix that stuff. Now, the third piece of the equation is how does this person move? Does this stuff automatically repattern their movement and teach them how to move properly? And the answer is a resounding no. If you think that fixing this and this is gonna fix how someone functions, unfortunately, that way of thinking doesn't really work, okay? Here's a perfect example. You get someone who goes into a squat or a deadlift, right? So I put squat, deadlift, and I'm showing a little stick figure picture here. And then you show how most people would bend forward to touch their toes, or if they went into a squat, Maybe they're just tracking knees like crazy over the ankles, or they're folding forward in the thoracic spine. Bottom line is, these patterns, these are patterns. They're movement patterns that are controlled by your brain. Motor control. Motor control. Your brain controls the coordination of how you're moving. Now, you need to have proper joint range of motion and proper tissue extensibility. So muscle, musculotendinous junction, that stuff needs to be able to move to allow you to get from point A to point B. However, how you get from point A to point B, that doesn't just magically fall into place. That's something that actually needs to be tested and then programmed and then reinforced. And all three pieces of this equation are super important for someone's overall health. And movement might be the place that people start. Movement is the place that an athlete thinks, okay, I want to come see you because you can improve my movement, improve my performance. How do I move well? Oh, I have to move well if I have proper segmental and postural integrity. And I need to learn how to pattern these movements properly. And we need to reverse engineer why we can't move well. What joint or what tissue is responsible for causing abnormal movement to begin with? And then once you address that, how do you repattern movement? And how do you program exercise, just corrective exercise, to get these movements back into normal working order? And then once you do that, how do you program that into your exercise routine that you do for strength and power? Okay, so that's something where I just said a mouthful. There's a lot that I just covered here, but the cool thing is that you can do this in a very simple and methodical way. I remember I understood this principle, but the thought of trying to grasp this and actually engage our patients in this process, it was daunting. It was daunting to me to think that, okay, how do I design these protocols? How do I keep track of this stuff? How do I keep a person engaged? How do I know what I'm doing clinically? There's so many different exercises to choose from. How do I know how to program it? How do I train my staff? That was all the stuff that made my head almost explode, which is why we've created these systems, which were not just one and done. They were refined and done over and over and over again until we have a system that's now been proven not just for our own clinic, because I still practice full time, but for the other doctors that we've helped with this as well, that are also seeing the same success and same structure and organization that we've created in our system called Move Now University. By the way, real quick, if you want to see how all this process works, go to demo.movenowu.com and you can watch a 30-minute demo, and it talks about all the moving pieces to this. This is way more than just a clinical approach. It's way more than just measuring movement and then applying correctives. This is all the things that actually speak to a human being. The fact that you have a patient who has these problems, you're trying to get them to care about this. You're giving them resources so that they can go through and do this. You're organizing it in such a way that it's motivational for them. You build a culture within your clinic, so it almost has a bit of a competitive type of nature where patients compete against themselves, and they also have friendly competition with other patients as well. It makes it a ton of fun. Okay, here's the thing I want to talk about. Breaking down one functional movement pattern. It's a very common dysfunction that we see. It's hip extension and how it relates to thoraco-lumbar pain, so up here, and possible low back pain as well, like lumbosacral pain, or mid-lumbar pain, I guess, for sake of argument. So now, what's supposed to happen, ideally, what's supposed to happen, and I know in the camera you can't see me here, but we have this drawn out. What's supposed to happen is that when you walk, or when you run, or when you propel yourself forward, your leg is supposed to extend 10 degrees. So that's what I'm doing right here. Here, I'll move this down just a little bit so you can see it. Okay. So your leg is supposed to extend 10 degrees. And if you lack hip extension because of tissues are bound up, the joint itself has a problem, which is a little less common than the tissues being bound up, or you lack the motor control, the know-how to fire your glute. Maybe you have glute weakness, glute amnesia. You're not firing the glute, okay, to get the leg back 10 degrees. If you don't do that, what do we inherently do? What's a really common movement pattern or a compensation that we do is that we propel the leg backwards kind of in a cheating way. We're not actually doing hip extension at the femoral-acetabular joint, but instead what we're doing is we're doing thoraco-lumbar extension to get the leg back, okay? Or lumbosacral hyperextension to get the leg back. And when you do that, do you think the thoraco-lumbar spine feels it and gets beat up? Yes or yes? Yeah, absolutely. Do you think the lumbosacral spine gets beat up and it starts to wear out that fourth and fifth lumbar disc, especially at the posterior? Absolutely. So to actually fix this, what we have to do is we have to make sure that the person actually has adequate hip extension range of motion at the femoral acetabular joint. So step one, does the joint even move there? There's tests and things we do to see that. Step two, let's say that the joint has the ability. What do the tissues feel like when the person tries to go through that range? All right, so we check passive and then we check active. And this is all stuff that we spell out and teach inside of our program, inside of our system, as far as how we organize all this stuff. And then after you figure out what tissues are responsible, what tissues are not firing, like I talked about glute, what other tissues are overactive synergists that are trying to produce this motion ineffectively, okay? So maybe they accomplish the motion short term, but long term it's not sustainable. It's going to cause injury, like it's going to cause excessive motion at the lumbosacral or thoraco-lumbar spine, and it's going to cause these other tissues to exhaust and cause pain and dysfunction, while the prime mover muscle, like glute max and glute medius, are asleep at the wheel. So AKA piriformis is an overactive synergist that will attempt to drive lower leg extension, hip extension, even though piriformis is mostly an external rotator and hip stabilizer. Problem is that overactive synergist, piriformis, will try to take over if the glute max and glute medius are not doing their job, which commonly are not. And all that stuff gets shut down as well when you have hip flexors in the front that are tight, possibly adaptively shortened from being in a seated position for long periods of time. Adaptive shortening is exactly what it sounds like. You're in a shortened position, you take the origin insertion of the muscle and you approximate them closer together like you're seated all day long. And over time, the tissues just want to stay in that position, okay? So again, I just said a mouthful, I'm covering a lot of stuff. By no means was I trying to go through and tell you every detail of the scenario. I just wanted to get you thinking about this, of how many times do you have a patient that comes in that has thoracolumbar pain or lumbosacral pain, and you work on them by adjusting the segment, and you don't do anything else to look at how much pelvic tilt do they have. Let's measure some movements to see how they're moving, and let's give them correctives to fix the movement. And one more thing I'll just show you too. Let's say that you're supposed to have a 40-degree sacral base angle. All right, that's a standard sacral base angle, a neutral sacral base angle. There's other variables that change that based on anatomical variances in the pelvis. And so I'm talking about 80% of the population should have about a 40% sacral base angle. And what'll happen is someone will at least momentarily increase their sacral base angle. They will cause pelvic flexion to create hip extension, and the pelvic flexion that's happening happens by causing lumbosacral extension and thoracolumbar extension, okay? So you see how this stuff is all linked together? This is a very common thing that we see with patients on a daily basis, and I'm guessing you probably see it as well, whether you're recognizing it or not. You explain this to a patient and they understand it. They feel it, they can see it, and then further, they understand the importance of fixing it, okay? So if you're having a problem with patients complying with care, wanting to stick around more than a couple of visits, there's a lot of inherent things that can be missing that can cause patients to disappear after just a couple of visits. Maybe you're not getting results. Maybe the patient thinks it's all about pain relief. They don't understand how there's systems that are involved together as far as to address cause of the problem. Maybe it's a communication issue. Maybe it's just a lack of having protocols, staff that you can train very simply to help assist in the process of teaching your patients this and rehabilitating them back to a normal functional person that they want to be. I mean, that's why they came to see you to begin with. They wanted to get fixed. And in their mind, they have pain. They think getting out of pain is getting fixed, and they need to be educated on, here's why you got into this problem, here's what it's going to mean for you long term, and either we can address the cause of the problem, which is definitely not going to be an overnight process because this problem probably didn't start overnight. So we can address the cause of the problem, or we can do very short-term care and we can serve as an expensive aspirin. Okay, because we're not going to fix anything. We're just going to give you temporary relief. The problem's still going to be there. It's still going to gnaw away at that joint. You're still going to break down those discs, and you're going to continue to have these reoccurring spinal issues because no one ever knew how to measure or fix the root cause. So anyway, if this is interesting to you and if you find this intriguing, put a comment below. Let us know what else you'd like to see. If you want to check out a demo that we made, it's a pre-recorded demo. You can watch all the different systems that go into place that are so much more than just a movement assessment and corrective strategies to fix this. It's everything from A to Z, like I said. It's forms, paperwork, how we do billing, how we document, how to communicate with the patient, how to engage a patient, giving the patient online resources for an exercise library and teaching them things they should learn over a 12-week period, how we structure our care plans ethically and honestly, how we even do this in a personal injury type of patient as well. I mean, what else? Our day 1 through day 5 process, because we have specific things we do on each day. Am I missing anything? Probably, yeah. There's a lot of other stuff too. But anyway, check out the demo. It shows you all this stuff. Hopefully this was helpful for you. Segment posture movement. This is, I believe, the future of chiropractic. This is what's going to keep us on top of our game so that we can encompass a lot of other things that other people out there are talking about. There's a lot of noise out there. A lot of other professions are kind of hinting at pieces of this. We as chiropractors owe it to ourselves and owe it to our patients to own this information, to be the best clinicians, and to take great care of our patients. So again, Dr. Todd from Move Now, and appreciate you taking the time to watch this. Check out the demo, comment below if you have any questions. Over and out. We'll see you next time.